Josh, without question, over the weekend, the interesting research I saw was, yeah, the curve is being bent, but there's a split between a better New York in a better selected urban areas and the beginning of an expansion of the virus in rural areas. Is that what you observe at Johns Hopkins?
Yes, well, overall, it's a plateau in the United States. It's not really going down particularly quickly. And there are certainly places like New York where it is declining, but there are also quite a few places, even some smaller cities, where it is increasing.
Well, it's increasing as well. Can they use the same methods from New York? I mean, what is the difference in medical treatment in Baltimore or New York versus the remoteness of some of these new places in America?
Well, I mean, you're putting your finger on an important issue, which is that the hospital system is not nearly as robust in many places. Many of the hospitals have closed in rural areas. Those that are open are very small and financially unstable. And so this has created an enormous challenge. People are going to, so it creates this dynamic where people may feel like, we're never going to have a problem like New York, but it doesn't take a problem like New York to tip that entire local healthcare system over.
There is all sorts of issues here about getting out of lockdown, all the images over the weekend and all that. What have you learned in the last 24 hours about getting out of lockdown? Well,
I think that people have to look past just the overall government decision. I think what's really going to matter is whether all of us, all the businesses, are following good public health guidance to stay away from each other, to continue to physically distance from each other. That is as important, I think, as some of the specific policies that are put into place. If people just go out and defy what's being done, it's going to be very hard to keep this disease under control. And if we open a little, which may be appropriate in some areas, but people take that as a green light to do whatever they want to do, it's really going to be a problem. There is nothing holding this disease back except our ability to stay away from each other right now.
Josh, when are we going to be able to understand this disease better? So there are a number of studies also trying to understand genetics, to try and understand why in certain countries, the mortality rate is much higher than others, although the lockdowns were very similar. What are some of the questions that you want answered to understand it better, and how soon can those answers come?
I think there are some very important questions, including some continued questions about how the disease is transmitted. And the role particularly that children play in transmitting the disease. I think that's going to be very important as we think about whether and how to open up schools. There's also some basic issues about the illness, why people with certain conditions are at so much higher risk of dying. And is there any way to predict early in the course of disease who is going to have a more severe illness? I'm also very intrigued by the reports that perhaps earlier medical treatment of certain kinds really helps. I mean, if that can be established, that could be very, very important. If it turns out that earlier oxygen therapy or some other type of intervention matters, that might change the way that medical services are organized and keep a number of people out of the hospital. So I do think that we've gotten a lot of scientific information, and we're going to see every week more and more insights. I think the frustration is that science doesn't necessarily operate by, one big headline and everyone agrees. It's going to be like these little, incremental steps, a couple steps back, a couple steps forward. But it's the kind of thing when you look backwards, you'll see how far I think we've come in our understanding.
What can you tell us about the Gilead therapy? So there was a setback, and now it seems to be on better track. Again, can we find out by the summer if this is one of the biggest hopes for the world?
This particular therapy, I think, is going to be potentially of some benefit, but most likely not of like a major, tremendous benefit. I think what I mentioned last time, I still think, which is we're going to have to see the ongoing studies which are using that drug at different stages of the illness, because the medicine might work so-so at one stage of the illness, but work much better or not at all at a different stage. And so it's going to be like a bunch of little studies that will add up to a much greater understanding. And then as we learn more about a particular medication, we'll learn more about the disease. If it turns out that, trying to block viral replication really makes a lot of the difference if it's given early, if the drug's given early, that might help us target other kinds of therapies. So I'm hopeful that we'll learn more from these other studies that will round out the picture of remdesivir.